COVID-19 hit the international community unprepared, irrespective of the fact that a variety of global risk analysis as well as national security strategies cited pandemics as a likely risk scenario.
Of course, for disease that we don't know yet, we need to prepare. We need to prepare for the disease X at national and global level, and to have a national mechanism and global mechanism who can deal with this kind of event. And the COVID experience showed that how much important all level to not only to detect, but also to manage and control and coordinate the response. The first case of any future pandemic disease will be detected at the community and at the primary healthcare level.
Whatever we do, we need local steps, we need national steps. But if we fail in putting them into an international global frame, everything will fail what we are doing on our national level.
But also the UN has a strong focus on disseminating accurate information about prevention and containment measures. We've heard some of the concerns around misinformation and how that can undermine a response.
And if we keep on doing what we've always done, we're going to limp along and not really make the world a safer place. It's inevitable there will be another pandemic. What's not inevitable is that we will still be so woefully underprepared.
2015. So I think we need to really recognize, instead of going back to systems that were unsustainable pre-COVID, we need to make a leap into the future with clean energy, with inclusivity, and with a focus on equality, with stronger social safety nets, including achieving universal health coverage and better preparedness for health emergencies, but also building in the better preparedness for multi-hazard risks.
Can be filled. What we haven't done is invested in filling the gaps. And there are three core weaknesses. One, we don't have the money. And the need is probably on the order of $10 billion a year for a decade. Now that's a huge amount of money, and it's a drop in the bucket compared to what it will prevent. So we have to invest wisely. Second, there needs to be very strong technical support for countries. And this is something we have to learn from successes and weaknesses of other global health initiatives. That technical support has to be of the highest quality, very rapid. And third, the managerial or operational capacity in countries needs to be increased. A lot of times it is really about management that makes all the difference. Even if you have the political will, even if you have the money, even if you're doing the right things, if you can't manage them well, it's not going to happen.
You can criticize multilateralism for a lot of failure. But if you do that honestly, in the end, you have to strengthen multilateralism. You cannot criticize it honestly without proper funding, without independence, strengthen transparency. And I think, of course, there are good reasons to make some questions about the situation after the first outbreak in China and so on. And there will be this needed independent evaluation, but it was hard to see how long it took this United Nations Security Council to act.